Welcome everyone. So in this episode, I wanted to talk about our new Fibion Helix device and its sleep tracking capabilities and the sleep metrics it gives. And just as a recap, Fibion Helix is a simple black wristband, but it hides inside a really nice technology. It has a patented optical sensor for heart rate and heart rate variability. It also has a wear sensor and it has a 3-axis accelerometer, and it provides all the raw data to researchers, but it also calculates different sleep metrics automatically. And accurate sleep metrics are crucial for understanding the interplay between physical activity and recovery and broader health outcomes. And Fibion Helix offers comprehensive insights into sleep patterns, delivering detailed data on sleep stages, sleep continuity, and sleep efficiency. And if we discuss a little bit about the different sleep stages and just summarize what is the importance of sleep stage. So light sleep serves as the initial stage of rest. It facilitates the transition into deeper stages, and it supports basic physical recovery and metabolic regulation. And then we have deep sleep, and it is vital for physical restoration, including muscle repair and immune system strengthening. And it is also associated with very important memory consolidation. So we really need deep sleep. And then there is REM sleep, so rapid eye movement sleep, and it is essential for cognitive functions such as problem solving, creativity, as well as for emotional processing. And it's the most active stage for brain recovery. And those are the sleep stages, and then also being awake is considered as one stage of sleep. And then if we look what sleep metrics Fibion Helix is calculating, we will first go to metrics, and then how does it calculate these, what variables it's using, what data it is using. So it gives total sleep time, so it's the total duration of sleep from onset to awakening, and it excludes the wake periods during night. Then it is measuring sleep efficiency, so it indicates the percentage of time spent asleep versus time spent in bed, highlighting overall sleep quality. And it also gives sleep efficiency metric, and this indicates the percentage of time spent asleep versus time spent in bed, and it highlights the overall sleep quality. It also gives a metrics for sleep continuity, and it assesses the sleep fragmentation by identifying interruptions, and this aids in understanding restfulness. And it also gives time in each sleep stage. So it provides a breakdown of sleep to light sleep, deep sleep, and REM sleep, and then it gives durations of each of those. And then if we look, how does it really calculate these different metrics? And it utilizes two key technologies. So it uses the 3D accelerometer data, which is measuring the acceleration of the wrist, and it captures the wrist movements to identify periods of rest and activity, determining sleep onset and wake times. And basically, this is important that when we go to deep sleep, basically our muscles paralyze, and then there will be no movement of the wrist. So that is one way how it looks. And of course, when we are awakened during the night, we move more than when we are in sleep. Then it looks for heart rate variability, which measures the variability between successive heartbeats to distinguish between different sleep stages. And for example, deep sleep is characterized by stable heart rate variability, while REM sleep shows higher variability. And for people who are not familiar with heart rate variability, it is different than heart rate. So we are actually looking the difference, the timing difference or the variability between successive heartbeats. And this is a very interesting signal as it's controlled by autonomic nervous system, and there is very nice mathematical ways to analyze and be able to distinguish when there is different parts of the autonomic nervous system gets activated, and this can be used to characterize sleep stages, for example. And then it integrates these two data sources, so it combines movement and heart rate variability data to segment sleep into light, deep, and REM stages. And maybe worth mentioning here is that for the optical sensor that is measuring heart rate and heart rate variability, it has a very advanced detection of wear and movement, and it can filter out the movement artifacts. And what you end up is with the very accurate heart rate variability data. So basically you can get with the very convenient, simple wristband that participants wear, you can get nice metrics of sleep. So it's very convenient, it's easy to collect. So this is a very good fit for different kind of project where it's important to have minimal participant burden, and this is often the case, for example, in large scale studies. And you could use this, for example, to explore connections between physical activity, sleep quality, recovery, and of course when you have 3-axis accelerometer on the wrist and you get also heart rate, you can get the very nice metrics for physical activity during the waking hours, and then with the same device you get also nice metrics for sleeps. And you could use it in longitudinal studies tracking changes in sleep over time. You could do intervention research aiming to improve, for example, sleep quality by improving sleep hygiene, or you could use it in studies examining the impact of exercise and sleep quality and vice versa, and a lot of different kind of applications. So to recap, Fibion Helix offers nice sleep metrics automatically, and in addition you also get the raw 3-axis acceleration data, you get the heart rate variability. So it should be a very good fit for researchers. And if you're interested in learning more about Helix, please visit our website fibion.com. And if you want to learn more after checking the website, there's a link where you can book a call with me or Dr. Miriam Caprita. And we are glad to have a chat and reply any questions you may have, give a demo of the device and see if it could be a good fit for your project. Thanks for listening and have a brilliant day.